Hi, this is Michael Gallivan, and I'm going to be recording my presentation for the effect of multilateral training in specialized athletes in reducing injury risk, improving physical literacy, and improving athleticism. It's a working title, but working into our introduction and background is early sports specialization has become much more prevalent in the past 15 years. The rate of early sports specialization has increased pretty steadily. So the goal of early sports specialization overall is to improve chances of scholarships, professional opportunities, gaining an elite status, gaining an edge over the competition, and just having better skill development in overall in your sport. It's also associated with a higher risk of injury, burnout, and lower lifelong sports participation due to that burnout. A lot of youth athletes, are dropping out by the age of 13. So the long-term athletic development and multilateral training are two models that are safer alternatives. They include sport sampling and deliberate play versus deliberate practice, where you're just learning skills in a holistic method. So they're safer alternatives with less downside to the early sports specialization. Kids are still specializing due to pressure from parents and coaches, so we need a way to mitigate the risks if they are going to still specialize. So in my problem statement, I state that despite the evidence that early sports specialization is potentially harmful, coaches and parents still do push for it. According to Lindner in 2023, 70% of children are dropping out of organized sports by age of 13 due to negative health outcomes, pressure from their parents. Anxiety and depression come into play here as well. So there needs to be a training method that's scalable, it's easy to explain, easy to learn, and needs little to no equipment for the athletes that, and then can at the same time mitigate the risks associated with early sports specialization to increase longevity and overall enjoyment of the sport. My research question is, can exercise intervention utilizing long-term athlete development principles improve movement screen scores and physical literacy while reducing injury risk associated with early sports specialization? So in a review of the literature, you find that early sports specialization is typically defined as a high-intensity year-round training in a single sport with the exclusion of others. It has roots in the 10,000 hours or 10 years to excellence statement by Erickson in 1993. This actually was intended for skills such as art, music, and chess. It was adapted to sport, so play a sport for 10,000 hours. You should be excellent at it or elite at that sport. In a continued review of the literature, there's a few factors that encourage specialization. One of the biggest one being social factors. It's a lot of, it comes from parents and peers and coaches, but this has roots in the perception of Eastern European athletes in the Olympics. Um, they were seeing success in individual sports, whereas specialization is common. The thing is with that is they actually do have they favor multilateral training in many of their sports selection and talent identification at a young age in Eastern Europe, but it was perceived that they specialize early, and people took that and ran with it and wanted to make that the way that their children could go ahead and become excellent and become an Olympian or at a similar elite level within their sport. So it also stems for a desire for talent recognition by parents and coaches. So the pursuit of scholarships and college opportunities, professional opportunities, and again, the desire to gain an edge over kids at the same chronological or similar chronological age because they're spending more time at that one sport rather than playing and being a kid. So psychological, a lot of it comes down to motivation in individual sports more than others because the pressure to succeed lies solely on the individual athlete, right? They have to be great on their own. They don't have teammates to rely on and lean on. So this does lead to anxiety due to fear of failure because the failure falls entirely on that individual when they lose a competition, such as a specialized tennis player or a gymnast. So there's a lot of motivation in their mind to train more at that sport, become quote unquote better at that sport or elite at that sport because it all rests on their shoulders. A physical factor that encourages specialization comes down to earlier physical maturation. So, if you've got a soccer player that's 9 years old, but they are taller than the chronological age peers, they might be pushed up from U10 or U11 to go train with the older children, the older athletes, and gain an edge, basically play at a higher level at an earlier age. That can lead to the belief and self-efficacy that they are better because they've been pushed up. So maybe they want to focus on just that one sport because they were pushed up in age because of their physical size rather than skill or overall development. There's some criticism concerns for early sport specialization. There's multiple position stands warning against early specialization that's outlined here. There's a risk of burnout, a risk of injury due to burnout. The burnout is both physical and mental, however, and the psychological impact that's been outlined in the literature includes depression, feeling of failure, the reduced enjoyment in the sport, and then overall, another criticism for early sport specialization is the low probability of competing at a high level. When you look at the number of high school athletes in a given sport that transition on to playing in college, it's between, depending on the sport, 7 to 16%. And if you look at that even further, the number of those athletes or the percentage of athletes from high school that go to a Division I can be as low as 1 to 2% overall. So it's not a high probability. And in the literature as well, there has been indicators that more often than not, the elite level athletes are actually athletes that were multi-sport athletes in high school. So the IOC, the International Olympic Committee, is in favor of multilateral training. There's a lower risk of injury with long-term athlete development, sport sampling, and or multilateral training, kind of all in the same umbrella there, because it increases enjoyment. They're sampling multiple sports. They're learning a holistic method of athleticism and training and physical literacy because they're trying different things and learning different skills, not just skills for one. And there is a higher rate of elite athletes that I mentioned before that did not specialize. It was found in a study by Steinel et al. In 2021 that 88% of NFL first-round draft picks from 2008 to 2017 were actually multi-sport athletes in high school. That is a vast majority. Lastly, there's going to be some justification for the training program that's going to be used as the intervention here. So the goal is to reduce asymmetries in limbs in a unilateral training program or an overall training program that focuses again on just developing skills overall and physical literacy. So injury risk can be reduced with specific training interventions, such as one study has seen Nordic exercises, and those can be scaled. You don't necessarily have to do a Nordic hamstring curl to do Nordic exercises full on. You can still do that type and reduce the hamstring injury risk because of basically the tension that you're putting your hamstrings under. They're gaining strength and stability. There's also been studies on preventive neuromuscular training to reduce ACL injury risk. So there's strength training groups, and then there's proximal control exercise groups. An example of a proximal control exercise is just kind of targeting the exercise or the muscles that surround a specific joint to strengthen around the joint. So for example, like hip and knee, you would do like a clamshell on your side to strengthen those hip muscles. You can load that up. You can change your tempo of movement to make it a little bit more difficult, a little bit more time under tension, but a lot of those exercises can target to reduce asymmetries, bring the athlete around in a more holistic approach to avoid injury and just land safer, move safer. Other exercises that you would want to do, skipping, running, jumping, learning how to throw and catch, just different skills, just a sample overall. So it's finding a balance between training for strength and athleticism and overall just developing skills. So there's a gap in the literature. A lot of literature separates early sports specialization and long-term athletic development or multilateral training into two separate groups. It's typically one or the other, not saying I can use principles from one to mitigate the risks of the other. So the goal here of this is to respect the choice to specialize, have a plan to mitigate risk, but you're not necessarily saying, hey, early sports specialization is inherently evil or bad. The goal is to say you can specialize. Here are the risks of specializing. It's good to be educated on it. And here are ways to get around that or to mitigate the risk, to make yourself more safe, athletic, sturdy, and stable. So goal of the study is design and test an intervention that mitigates injury risk regardless of specialization status, whether or not you are a quote unquote specialized athlete. So for proposed methods here, it's obviously going to recruit athletes who specialize in one sport as to be my participants here. After receiving informed consent, the subjects are going to come in for baseline testing. So we're going to do 4 movement screens, the FMS, the landing area scoring system, star excursion balance test, and overhead squat assessment, as well as 2 speed and agility tests. 20-yard sprint timed, they're going to get 3 trials and we'll take the best time, as well as the 5-10-5 pro agility test, 3 trials of that as well, take the best time for that. The athletes are going to be divided into 2 groups. So they're either going to be a control group where they just continue to train their one sport as they normally would, or the intervention group that's going to get an interventional program. It's a standardized program. I'm just going to give everybody basically the same thing, just in the hopes that this can be something that can be a template that can be used for other coaches down the line to mitigate those risks. It's going to be 3 times a week for 8 weeks. At the end of that 8 weeks, we're going to come in and retest all the movement screens, 20-yard sprint and the 5-10-5, and analyze for differences in both groups from baseline to follow-up, as well as between groups. So inclusion criteria for my subjects is going to be ages 12 to 15. Reason for this is a lot of times in the literature, it's in favor of specializing after the age of 16. That comes with a long line of developing skill and physical literacy. And now you're 16, you're a little bit older, you're a little bit more physically more mature. Go ahead and specialize, right? But then again, another inclusion criteria is going to be currently injury-free, no injuries within the past 30 days. And they specialize, so they participate in just one sport for, I'm going to say greater than 9 months per year. That might change, might be longer than that, but they have to be a one sport athlete exclusively, with the exclusion of other sports and other play. So exclusion criteria is that you're a multi-sport athlete or that you've been hurt in the last 30 days, you're recovering from an injury. So the materials, we're going to have the FMS, the Functional Movement Screen Test Kit, to properly do that test. We're going to have a camera to record movement screens, so the LESS test and the SEBT, as well as the overhead squat test. It's nice to have that to refer to so you're not making your decisions live action. So we're going to record that. Plyometric boxes needed for the LESS test. Also not listed here is tape to mark off the shape for the star excursion balance test. You need a stopwatch to time the agility and speed tests, and then exercise equipment. So this is going to be taking place if in person at Western New York Strength and Conditioning. So dumbbells, kettlebells, resistance bands, medicine balls, plyo balls, wobble boards, plyo boxes, and PVC pipes for overhead stability and work, stuff like that. I'm going to be using the Coach Me Plus application for the exercise programming, so they have it in the palm of their hand. It's on their phones, it's on their tablets, on their computers, as well as data recording for the movement screens. Any notes and stuff like that is going to be recorded right within the app. And then the baseline scores are going to be exported into SPSS. Measurements, pretty straightforward, pretty simple, already discussed. FMS, LESS, overhead squat assessment, star excursion balance test, 20-yard sprint time, 5-10-5 pro agility time. Intervention strategies, randomized control trial. So each subject is going to be randomly assigned a number. Just basically when they fill out their informed consent, they're going to be subject 01, 02, so on down the line. I'm going to then put that list into Excel and randomly pick numbers and split them into two random groups. Group 1 is going to be given the exercise intervention. The other will carry on training for their sport as usual and just will come in for the 2 visits, the initial and the follow-up tests. Going to run t-tests, planning on running t-tests for the statistical analysis. So it's going to be difference in the means from baseline to follow-up for each group, and then as well as difference in the means between the control and intervention group at baseline and follow-up. Do you see any significant differences if one group significantly improved over the other due to the intervention or not? So limitations on this is really length of time. So 8 weeks is sufficient to see some change, but maybe not sufficient to see all of the change that you want to see. So essentially, this is just kind of pointing to future research, future literature. Maybe you're going to want to fine tune the program, make it a better program, and do it for a longer period of time. So that's going to be a limitation here. Another one is amount of supervision. So the goal is obviously to be in person with these athletes every single time, have them come into the facility and observe and form on their exercises, make sure that they're safe and doing this properly. However, due to scheduling and stuff like that, it's going to be mostly remote training because there's going to be no way 7 days a week I'm going to be able to get into the facility to work with these athletes and so on and so forth. But there is a capability of video analysis of the exercises and chat functions and tracking of load and stuff like that through the app to make sure that they are safe throughout the protocol. And then another limitation is just that these movement screens are subjective. One rater of the FMS might rate your deep squat as a 2, the other one might see it as a 3. So I'm keeping it the same. Same person's going to be doing the FMS screening, me, for every single one of these athletes, but my rating might be different from somebody else. So that's another possible limitation of this study. So contributors here, my chair of my committee is Dr. Miyashita. My dissertation reader is Dr. Winchester. The methodologist is going to be Dr. McBride. I am myself the student. And then I wanted to give a shout out to Steve Titus, owner of Western New York Strength and Conditioning. He's my Olympic weightlifting coach, has been since 8 or 9 years now. The guy is a walking textbook, a walking research study. So he's had a hand in a lot of this. He's a great coach, has a good eye for this stuff. So I wanted to give him a shout out as well. for all the help that he's been giving me along the way, and all the times that he's read through my papers to give his feedback. So, to my list of references,